The 2008 Foursquare Children of Promise Medical Clinic was held in a Prekbai Church Orphan Home in Pursat Province from August 4th to August 10th. The kids and staff camped out while together members from the U.S. Desert Springs Church, our Foursquare Cambodian Church, and more than 200 volunteers worked to turn the compound into a medical village. Setup took place for 3 weeks before the event opened, and operations required a volunteer staff of nearly 150 to provide everything from safe water, clean sanitary facilities, electricity, security, meals, and the step-by-step care that comprised the clinic. It does take a village, but it also takes money. Major funding came through the Foursquare Foundation and the Everett, Washington Foursquare Church. Patients came from towns and villages up to 100 miles away. They traveled by motorbike, ox cart, and even walked great distances. Each was anxious to receive medicines and medical attention that they may have never received in their lives. Those that needed emergency assistance were given priority service. Those that were not as seriously sick went through the time-tested process that FCOPI has developed over an 8-year history. Once through the gate, everyone was welcomed and given a tract simply titled God. As they moved towards registration tables, their names and villages were recorded, as well as an initial triage done. With registration complete, individuals and families were able to sit and enjoy a variety of entertainment, from music to traditional dancing and comedy skits. The performances were blended with sharing of the good news of Jesus Christ, along with prayer for healing and salvation. Individuals also received literature provided by Foursquare Missions Press. None was seen to be discarded, and many wanted extra copies. When it was time to see a doctor, each patient was directed to one of 29 medical, dental, surgical, optometric, emergency, wound care, or diagnostic stations. Medical professionals from the U.S. and other countries used Cambodian translators that had worked for more than a month studying medical terminology. The Cambodian doctors, well, they went straight to work. A well-stocked pharmacy was set up in the church sanctuary, and runners were sent from each doctor's station to retrieve medicines for specific treatments. If needed, a lab was called on to complete blood and urine testing for such diseases as malaria, dengue fever, and diabetes. Infected teeth and gums make the whole body sick. Many patients were in great need of dental care, and a fully equipped dental van and 3 additional stations were staffed by a team of both foreign and Cambodian dentists. Our dental team treated over 400 patients for everything from extractions and simple cavities to root canals. Wound care and scabies treatment was also a busy location. Cuts and minor injuries easily become infected in the poor sanitation that people live with, causing much more serious problems. The wound care and scabies unit cleaned and dressed countless cuts and scrapes, as well as provided a cleansing, parasite-freeing bath and a new set of clothes, all of which brought a smile to the children suffering from scabies. Before departing, each person met with one of our Cambodian pastors, who made sure they understood their medical instructions, prayed for their continued healing, and introduced them more fully to Jesus Christ. They left feeling better, body, soul, and spirit. By the end of the medical clinic, 9,207 patients had been treated, and 8,196 had received Jesus as their Lord and Savior.